a whole group of healthcare workers got fired or placed on administrative leave because they decided to make fun of patients and then post about it on TikTok, publish the video. So the medical staff at Sutter Health Urgent Care, located in Santa Barbara, they decided to post this on TikTok, posted by the username Angie Cut. So I'm not going to play the music, but we're going to go through this. The caption goes, "Can you guess the substance?" And then you have, "Are patients allowed to leave you guys gifts?" So obviously what you can see here is an examination room. So as the patient gets up from the table, he or she has left a bodily fluid. And so they are posing photos next to the fluid. Are patients allowed to leave you guys gifts? So we have yes, followed by, "and we love them so much." And we also have "all shades and opacities," followed by "all shapes and sizes." And then we also have "make sure to leave your healthcare workers sweet gifts like these." Now, I can easily see why some people may view this as not a big deal. I mean, going through the comments on social media, there are a lot of people who actually don't think this is a huge deal at all. It's just a bunch of medical staff having fun. But here's the issue. Let's start with being professional. So, working in the medical field, there's something called HIPAA. Now, do I think I'm going to be able to find out the person whose bodily fluid that was by looking at the fluid and etc.? No, but there is a level of professionalism here, because for all I know is if I have to go to this urgent care, I'm going to think if they are joking about this and they're able to post this online, what else are they not professional with, like behind the scenes, the things they don't post online, the things that are just taking place at that urgent care that I'm walking into, feel me? And it gives a sense of we don't care about the patients. It gives a sense of you guys are a joke to us. When you come in here, you are a joke. Also, it's just unethical. It's weird because me working in the medical field, I have come across people all the time where it's such a challenge to even walk into an urgent care, walk to see your primary physician, because people, for their different reasons, they don't like to seek out healthcare. And the first thing that people are afraid of, in my opinion, just talking from experience, is being ashamed of whatever the case or the situation may be. And it's so hard for people to already come in to tell a stranger this is an urgent care, their problem, what they're going through. And some people, they are aware that they are not to be, gross or anything, but dripping or sweating from down under. So yeah, when they get up, that's probably embarrassing alone. You want to make people feel, when you go to any type of medical place, you want to make people feel like they have a safe place, that they are in somewhere, a place to where they can trust their provider, and to where, your medical staff is not going to treat you like a joke. Now, do I think these people need to be like to get their licenses taken away or etc.? No. I think actually firing is the appropriate response to something like this, just because, forget everything else, this is just a liability. If I have to go to this Sutter Health Urgent Care, the first thing I'm going to think of is that staff there? Do I have to now watch how I look and how I dress? Are they going to judge me? I'm going to have so many things going into my head to where that location will never be a choice for me. Just because, like I said, this is all jokes and fun, but if they can be this unprofessional online, how are they in real life when I walk in? What are they whispering to each other? You know what I mean? So it's more of just, even on a business standpoint, no. They need to go. And this is the appropriate response. And what makes this news as well is that you didn't have just one idiot here. You had a whole entire group of people who agreed to pose next to bodily fluids and thought it was okay to make fun of the patients. And this wasn't a thing, it'd be different. It would be okay, but it would be different if this would have had just stayed, I don't know, between them, it would have been different if this would have had never seen the light of day on social media. But then they decided to post it. Like, what did they think was going to happen? I'm like, why isn't... So this is why this brings me to, because this many people were involved in this stupid post, which leads me to talk about compassion fatigue. I'm going to leave a definition up here. Let's read it. Compassion fatigue is a state of emotional, physical, and mental exhaustion that occurs in individuals who work in caring professions or are exposed to prolonged or intense stress related to witnessing or caring for others' suffering. Now, I promise you, I'm not trying to make any excuses for these medical staff workers, because I feel like they all should be fired. That's the appropriate response. I do not think their license should be taken away from this. I think this is a huge learning lesson, a huge wake-up call to not do this stupid behavior, this dumb act ever again. But, you know, just last week, I was talking about compassion fatigue because there was a firing that happened in my personal life with a paramedic, and it all came down to, you know, people doing stupid things. Because when you start to, a lot of medical people, when they start to witness so many tragedies and they start to, you know, especially working in an urgent care, they work in an urgent care, so they're probably hearing like a bunch of some things that aren't truly urgent, but also constantly witnessing tragedies, right? And at a certain point, you're either going to joke about it, have fun about it, try to make what you can in an overwhelming situation. Or if you're not posting and making fun of someone's situation or making fun of the patient, some people, they argue with them until they lose their job. Compartmentalize the professionalism and how unethical this was. There comes a point to where you're witnessing so much tragedy that you completely forget to be a human being, because this was dehumanizing. This was the behavior that they did. This was, we don't give a shit about the patient at all. We're not even thinking about the patient, because they've seen so many of this that they just stopped caring. So I do think that this is a subject that needs to be talked more about when people go into medical school. Hell, even like CNA classes, any type of medical program, nursing program. Because I cannot stress this enough. There's so many people that lose their job over compassion fatigue. That's what I call it. You see so much of this that you stop caring about the patient. You stop looking at them as a human and start looking at them as a joke, or you start arguing with them. I'm curious to what you guys think about this, because some people still pass this off as a joke. I don't think in the medical field you can joke like this publicly. I don't think you can, because let me tell you, I work in the medical field and there are plenty of days where I want to press the record button and just start a channel of where you are my best friend. We sit, you grab your tea, your snacks, and I'm sitting, we talk. There are plenty of times to where I would love nothing more than to just have a channel where we can just sit and we can chat and be like, girl, how was your day? You know what I mean? But I can't do that. You know, I can't do that. There are plenty of times I can't tell you, like, I've had moments of, you know, people like dying or people passing away. They'll have moments where they're serious moments, and I'm glad I have someone to talk to. And I'm glad that if I need therapy, it's there. But there's one thing that you can't do, is you can't post about something like this, because even though it may come off as unserious, this really illustrates their professionalism. Like, what makes them think that anyone wants to walk in there if people are going to think that your staff is going to post videos about the patients? Now, luckily, this staff got fired. And so no one ever has to worry about that again, but it's just something to think about the next time anyone decides to do something stupid, okay? Like, this just isn't, it just wasn't worth it. And I just have a hard time swallowing all this, just because it wasn't one person who did this. The whole staff, like, none of them thought, hey, let's think about this. So anyways, I blame part of it of just being unprofessional and being stupid, but also what comes to mind is compassion fatigue. What are your thoughts? I'm Blossom. Thank you guys for watching, and I will see you soon on the next video. Bye, guys.